meeting. If you don't mind, we'll open up our meeting with a word of prayer. Let's all bow together, please. Father God, we love you. We thank you for this opportunity to come together to do business on behalf of our counties, Lord, for our district. Lord, we just pray that you'd meet with us tonight. You give us your wisdom and just help us, Lord, as we try to lead our counties and we try to provide guidance for our counties, Lord, that you'd give us the ability to do that and to do that in an effective manner. Lord, as we enter this holiday season, let us be ever mindful of your son, Jesus, who's the reason for the season. Lord, help us also to remain healthy because we're facing a difficult time right now and a lot of concerns and a lot of unknowns. Lord, we just pray for your protection for our families and our friends and our loved ones, Lord. We just ask this tonight in Jesus' name. Amen.
Amen.
We'll go ahead and ask Melanie then if you'd like to do a roll call to make sure we have a quorum.
Judge Anderson? Okay.
Yeah, I did.
Did he say he was here?
He did.
Okay. Pam Bills? Dr. Brown?
I think Pam's
Here.
Did somebody say that Pam wasn't there?
I think she's muted. I see her, but I think she's muted.
Okay.
We can see her, so she's trying. We're trying real hard. She's smiling, but she's there.
Okay. Kristen Branham? I see her. She typed in here. Okay. Judge Cowan?
Here.
Judge Craig?
Here.
Judge Dial? Okay, I don't see. All right. Dr. Falazaday? He's supposed to be here and he's not here yet, so I just want to make sure he wasn't on. All right. Gina Good?
Here.
Okay. Okay. Patty Gwynn?
Unmute. Here?
Oh, okay.
Did you find me?
Hear ya. Oh, there you are. I see you now. Okay. Matt Jackson? Oh, I see you're in the text box. Okay. Dr. Jasper?
Here.
Okay. Judge Kelly, I know you're there. Okay. Kay King?
Here.
Yeah, I see you're with Gina. Okay, I see it in the. All right. Dr. Lee? Okay. Dr. McKinley? Dr. Miles? All right. Dr. Perkins, I see you on there. Judge Phelps, I see you. Okay.
I'm here.
Dr. Phillips, I
I'm
see
here.
you. Okay, I see you on there. Okay, Dr. Rexroth.
Here.
Okay. Dr. Richardson.
Here.
Okay. Judge Robertson. Let's see. Okay. Jake Staten. Jim Wesley. He may be just a little late getting on. He said he would be on.
Well, he's actually on. He had a little trouble with his microphone earlier, but I know he's on.
Okay. Greg West.
Greg West has resigned from the board, but Joe Silvers, the chair of the Wayne Board, has appointed himself in his place, and he is here. Or you can call his name, or or he can say he's here, but I see him.
Okay, I'm gonna just type his name over that one then. Rosalie Wright?
Here.
Okay. All right.
Did you call Judge Smith's name, by the way?
No, because they were gonna be proxied. He was gonna be proxied.
He sent his proxy, and if you can see it here on the screen, he has signed it to Judge Cowan.
Okay, I count 21. Is there anybody that I missed?
Melanie, this is Judge Dial. I'm here. My microphone was muted.
You got 38 participants logged in.
Well, some of them are employees. So that makes
Well-
22.
17's or 16's a quorum, so we're good.
Yeah.
All right, great. Well, thank you, Melanie, and we do have a quorum, so we'll go ahead and open up this meeting. First item on the agenda will be the approval of our minutes from our previous meeting, and you all have a copy of those. Would there be any additions or deletions you'd like to present to the board tonight?
Motion approved.
We have a motion by Judge Anderson to approve the minutes,
I'll second it, Judge Craig.
second by Judge Craig. Is there any further discussion? Being none, we'll vote all in favor.
Aye.
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 Any
Aye.
opposed? Hearing none opposed, the motion carries. All right, next item on the agenda will be our old business. We always like to ask if there's anything that the administration failed to adequately follow up on from the last meeting. Hearing nothing there, we will move on then to our election of officers. Currently, we have the chairs, myself, Judge Steve Kelly. Vice Chair is Dr. Gail Phillips. From Taylor County, past chair is Judge John Phelps. From Cumberland, at large is Dr. Hossein Falazadeh and Dr. Richard Miles and Judge Gary Robertson. So we need to re-elect or elect a slate of officers. Sean, would you like to speak to that?
Well, it's really up to you guys who you select. It's been my observation through the years that the board generally keeps its officers if they're willing to continue to serve, unless there's somebody there that really wants to start campaigning.
So we will open up the floor for any nominations if you would like to make a nomination.
I'll make a motion, Judge Craig, to keep them the same.
I'll second that motion.
Well, we have a motion and a second. Thank you, guys. You all are awfully kind. So do we have?
Well, we think you deserve a different year. I mean, 2020's been rather unusual. And, we think you deserve another round, Judge.
I guess then we would need a motion if the others are okay for the nominations to cease.
So moved.
Second.
We have a motion and a second. All in favor that the nomination cease?
Aye.
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 Any opposed to that? Okay, so then I think we had a nomination or a motion then that the slate of officers stays the same. So we have a motion by, who's that, Judge Craig, I think?
Yes, sir.
Second by Judge Phelps. Is there any further discussion on that matter? If not, we'll say all in favor of keeping the slate of officers the same. Please indicate by saying aye.
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 And likewise, any opposed? All right. Well, it looks like we have a slate of officers, Sean. So
Very
we'll-
well. Very good.
we will move on then with our resource stewardship. And first thing we have is our audit report.
Yeah. Rundy, is our auditor on?
Yes, I am.
All right. I've got the audit here. I can pull it up on the screen if you want me to share it here.
Okay, that'd be fine.
That's the
All right. Yes, sir. So my name is Brad Hayes. I'm with RFH CPAs out of Lexington. We've been performing your audit for a few years now. So I'll just kind of take you through this quickly. But if anybody has any questions or anything, feel free to stop me. Sean, let's go to the independent auditors report. There we go. So in this, we talk about management's responsibilities for the financial statements, and then we get into the auditor's responsibilities. Then down towards the bottom, we have to issue an adverse opinion on or in accordance with U.S. generally accepted accounting principles, because you all are required to report in accordance with the administrative guide or going down to the next page there, Sean, if you don't care. You all have to report in accordance with the administrative reference, and I apologize, which is stipulated by Frankfurt. So the second paragraph there, we do issue an unmodified opinion on your regulatory basis of accounting, or a clean opinion, if you will. So below that is under other information, we just talk about some of your supplementary information as far as your supplementary schedules of revenue and direct and indirect costs, and then your schedule of expenditures of federal awards. And then the last paragraph talks about a separate report that I'll get to here in a few minutes, but it's a report that's required under government auditing standards and talks about your internal controls. So the next page is your statement of assets, liabilities, and fund balance, or balance sheet, if you will. So you can see there at June 30th, you had roughly $7.6 million in cash on hand, and that was an increase of about $1.3 million over the year before. And then you also had certificates of deposit totaling just over $2 million. So you had total assets of $9.7 million. And then your current liabilities, you had about $98,000 in just payroll withholdings and that sort of thing. And then your fund balance, so you had unrestricted fund balance of about $5.6 million. And then you've got restricted balances for different programs there. And then towards the bottom, the state, federal, and fees. So overall, you had fund balance of about $9.6 million. So on the following page, your statement of revenues, expenditures, and changes in fund balance. So overall, your revenues came in over budget by about $350,000. And then your expenditures, while they did come in over budget just a little bit, it was only about $88,000. So your revenue overage certainly was more than enough to cover your overage and expenditures. So you can see their excess revenues over expenditures was $1.3 million. So that's, in essence, that's your change in cash for the year. So following that, we get into the notes to the financial statements. And I'm not going to go through necessarily all of these. So if you can keep scrolling there, Sean. Note number 2 there under cash and investments. That little table that's down there, you can see that all of your deposits were fully insured as required under Kentucky Revised Statute. On the next page, that's just a detail of your state, federal, and fees as far as how they're restricted for each of the programs. Following that, We have a disclosure about the Kentucky Employment or Kentucky Employees Retirement System Plan. And then towards the bottom of that first page, the next to last paragraph, you can see there the district contributed 2.6 million, almost 2.7 million into the retirement plan, which was 100% of what you were asked to put in. The paragraph below that talks about your approximate potential pension liability there of about 55, almost 56 million. And then the next paragraph talks about your potential OPEB liability of about 8.7 million. I just want to remind everybody that both of those numbers are based on just actuarial valuations. They don't have anything to do with whether or not you all have paid in everything that you're supposed to pay in, because you have. So anyway, let's see here. Number 9, related parties. That's just a total of what was paid in from each of the taxing districts. Note number 10, we've just added sort of a generic COVID-19 note that just says you all are evaluating any impacts, on your service and that sort of thing. And then note 11, subsequent event, House Bill 352 passed earlier this year, basically, again, allowed you to pay a reduced KERS funding rate, as opposed to the 83% that a lot of the other state is paying. So you've got a reprieve for another year. The following 3 pages are details by program of where all of your revenues came in as far as which programs, and then your direct costs, and then your indirect costs, again by program, and those are required schedules from the Department of Public Health. This report here is our report on your internal control over financial reporting and on compliance. And in here, we don't give an opinion on your internal control, but we are required to report anything that we think might be a material weakness or a significant deficiency. So I'm happy to say that we don't have anything to report here. So again, that's a clean letter. The next piece of letterhead is our report on your compliance for each of your major federal programs. And in here, we do give you an opinion. It's at the bottom of this first page. And we give you an unmodified opinion on your handling of your major federal program, which in this case was WIC. I'm sorry. You can keep on scrolling. So these 2 pages are your schedule of expenditures of federal awards, and these are just classified by CFDA number. Again, these are required federal reporting schedules. And then following that is your schedule of findings and question costs. Again, we're required to identify your major program there, but we don't have any findings. We don't have any question costs. The 2 pages past that, we don't have any prior audit findings, and we don't have any proposed adjustments.
Yeah. And just so the public knows, the board members all received this entire packet by email, and we also publish our audit report on our website under our reports page, as well as our budget and a lot of other financial statements. So anyone that wants to review that has an opportunity to do that.
Okay. Does anybody have any other questions or comments?
I can say that we do expect our retirement contribution rate to go up after the next legislative session. When I get into my financial report, I'll talk a little bit about that. I think I added up the 2 categories, and your projection was 63 million. I think I've seen one projection as high as 75 million, maybe, for what we are indebted to the retirement system. So at some point, we'll have to start making payments back to that one way or the other, whichever way the state legislature decides to set that up. So we'll be anxious to see how that sorts out.
All right. Well, any further questions then from our auditor? We do appreciate the work you've done. We'll move on. The next item then will be our financial updates and our director's comments.
All right. Thank you. Have a good evening.
You're welcome. Thank you for joining us.
You're welcome.
Judge, as far as director's comments, we've been smothering in COVID-19 for a long time, no pun intended. We've basically used every employee we have in some aspect or another as part of our response, and we've hired a number of folks. We've placed a number of folks that's through a state contract inside our agency, and we're, as far as doing case investigations and contact tracing, we are keeping our nose just above the water. And as far as getting data entered into the state systems, we're a few days behind. We're probably 4 or 5 days behind on that. But we've been doing pretty good. We've got more staff assigned now to do the data entry stuff, and we've made some significant progress in the last couple of days. But it's been a challenge. We've experienced a significant surge the last few weeks that's really pushed us hard. We've had to restructure and pull everyone into the response, and we've had to hire people, and we're just doing the best we can. I say this, and I'll say it to you guys. The health department, most of what we've done through the years, we've enjoyed very broad community support. Running our clinic programs and the different things we do, and when our environmental programs, the public largely agrees that sewage running out is a bad thing, or a rat infestation in a grocery store or a restaurant is a bad thing. Certainly not everyone agrees that COVID-19 is something that we need the restrictions and things. So we're in a really tough spot. We got some of the public that thinks we're doing too much, and some of the public that doesn't think we're doing enough, and we're constantly caught in the middle of the political back and forth with that. We're just doing the best we can. As far as our financial report, I will share my screen and just run through that, unless someone has a question about any of the COVID stuff I talked about. So, and Ron is on, and if I say something out of line, Ron, you're welcome to jump in and correct me. Again, everyone got this as part of your packet, but I'll go ahead and display it on the screen for the benefit of those who might be watching in by YouTube Live. This is our through period ending October 31st. We haven't had a chance to close out November yet, so this is the data we have. Ron puts most of this together, but you can see here at his best guess, we're still looking at ending at about a $1 million surplus. Had we had to start paying that increased retirement this year instead of it being put off, that surplus would have been much closer to break even. But for the last few years, we've been running at a little over $1 million surplus, and the state has allowed us to continue to just put that back to pay toward that $75 million retirement liability. So at least we're getting some money put back for that. You do see that the state hasn't billed us in a while for Medicaid match payments. Looks like we owe about $300,000 for that, but so far the year is going pretty good financially. I'll talk about that in a little bit more detail in a minute. Right now we're running at a $127,000 deficit. But if you look up here, this category that I'm putting my mouse over is our local tax revenue that comes in, and it shows that we're 1 million behind on that. But we annualize these numbers across 12 months, but we really don't start collecting the local tax money for a little while, and that'll come in, so that's going to more than cover that deficit. Some of the service fees we're behind on, we may not collect because we're so displaced right now doing COVID-19 We're just not doing as much of the regular clinic stuff. As far as these bar charts about how we're performing versus how we budgeted, when we budgeted last year, we budgeted under the assumption that we wouldn't be doing COVID-19, but that's basically all we've been doing. We do try to do some of the other programs as we can, but you're going to see on most of these things, we're going to not, they're not going to match up real good this year like they usually do, because we're really pulled away from our programs. So can't really judge us by this other than COVID. Fortunately, as far as COVID goes, we've been getting federal pass-through funds that's coming to us, and should the funding continue and should we need to keep continuing to do COVID through the rest of the year, we're going to end about financially the same either way. So financially, it's going to be about a wash, whether we switch over back to the traditional things we've done or whether we continue to do COVID. So that's at least good news. Go ahead, sir.
I'll interrupt you if I can for just a second now. And I'm assuming in the time of COVID that all other health departments and health districts are doing seeing similar things. They're putting their other programs on the back burner while they're dealing with COVID. Am I correct?
Every health department does things differently, so I can't speak for all of them. My feeling is when you look at the state map about the incidence rate, all the health departments are really struggling right now to keep up. I feel very confident they're throwing everything they have at it. So I can't speak for all of them, but I feel like most of them are throwing everything they've got at it, Judge. All right, I'll go back to
everybody to understand that this is not necessarily a bad thing. It's the sign of the times, and we're doing what we have to do to stay up with it. And I'm certain we're not alone in the way we're handling this.
Well, there's certain things we have to continue to do. We have to do STDs and rabies, and there's certain things we can't stop doing. So we still do the things that are absolutely necessary. So we've not abandoned everything, but anything, and we've not abandoned anything completely. We're just putting things on hold while we respond to the pandemic. So back to the financial report. This is just our balance sheet. It gives you, where we're at in a balance sheet format. This is where we are this year compared to where we were last year. And you can see we're doing very well compared to where we were last year. So that's good news. This is shows services for year. And it's kind of an odd year to look at this because, our services are going to be down other than COVID services anyway. But if you look over the years, our demand for our clinical services have gone down. And other than in COVID years, we've adjusted our staff complement to match what our actual demand is. A lot of our services have been picked up by private providers, and it's not necessarily our being a public agency, our job to compete with the private sector. And if the private sector can service a need, it's fine for them to take it and us to switch out, even though we hate to see some of our traditional programs go away. That's just the nature of the way things work. If the private sector can find a way to make a buck off of it, then that's the American way. So on the financial analysis here, this is just all of our revenues by cost center and our expenses by cost center. And again, this is kind of an odd year to look at this because it's going to be all over the board because we're not executing the way we budgeted. This is an interesting report. I always like it because it shows how much money we've billed versus how much we've collected, and we've still got $604,000 in the pipeline. We will get a good chunk of that. Usually we don't get it all, but we get 75-85% of it by the end of the year. And again, this is just another way to look at the revenues and expenses. It shows you how each program is performing before or after we have to put in local tax money or state money. So you can kind of see how everything is as far as standing on their own. And this is our unrestricted reserve calculation. The bottom line is we're projecting to do well right now. Through where we are at this part of the year, we're at a lower place than we were last year. But by the end of the year, if we end at the $1 million surplus we're projecting, we'll on our unrestricted reserve, that'll go up. These restricted reserves are reserves that we have, but they're restricted to certain cost centers. And the only way we can use that money in something other than the designated cost center is to get special permission. This is really the money that we have to, well, actually our unrestricted reserve, which just shows we're $1 million over what we're allowed. So we have 4 million unrestricted reserve. Is allowable last year, and we ended with 5 million. And right now we've got 5.6 million, and that'll go up. So we'll have somewhere over $6 million in unrestricted reserve to start making payments back to the retirement system.
Hey, John.
Yes.
John, the one on the right, fiscal year 20.
Yes. Oh, I'll put that back.
Pull it back up.
Yeah.
That one is actually where we ended as of June 30th.
Oh, I'm sorry.
No, you're fine. So the 752,000. That is what.
What we're over what we're allowed.
Correct. So yeah. we haven't actually had the state ask us what we're going to do with that yet. But that will eventually get moved into something else, and more than likely go into retirement to be able to pay out the retirement whenever that comes due before long. So yeah, I just wanted to point that out.
Yeah, I'm probably not being clear. This is how we ended 20, but when we get to closing FY21, this will go up. And so the unrestricted reserve that we have will probably go up to around 6.5 million or something, somewhere in that neighborhood. But so we're doing pretty good as far as putting money back to make a payment toward the retirement liability. This last page is just some disclosures that we give. You all approve our plan and budget, but the state and federal government, they either, of course, they allocate us money by cost center, and then as the year goes, they make adjustments and they either take some of it away or give us more. And we give this to you just to see where our funds have changed as far as our allocations based on what you had approved for us. So you can kind of see a lot of these are increases for COVID. So basically that's good news. So anybody have any questions about the financial statement?
Mr. Crabtree,
Yes.
when you mention the COVID and the contact tracing, I know other districts have stopped contact tracing. Do you anticipate that LCDHD will do that as well, or no?
Well, what we're finding is the places that stop doing contact tracing, it really just moves the work to a different department in the agency, because there's so many people that, if they're told to quarantine or whatever, they need a letter for work or they need a letter when they're off quarantine. So basically it moves the work over to a call center or into the clinics. So, we're certainly not doing contact tracing to the same degree we did when we were having 5 or 6 cases. We're much more selective, but no, we haven't completely given up contact tracing, even though we don't do it at the same level we used to do. And again, okay, it's just so we don't want to just push that workload over to another part of our health department. Any other questions about that?
All right. Well, thank you, Sean. If no other questions, we'll move on then to our grants report. Jamie, you want to speak about Heart for Change?
I think Melanie's going to cover that, Judge.
Oh, I'm sorry. I'm dyslexic. It's like,
yeah.
Melanie, would you like to speak to that?
Yes. Okay. This is our grant report for December 2020. We've had a transition in our grant department. We now have the grants department under human resources, and Carol Huckabee is now the manager of it. Natalia Sigurdsson will now be the main grant writer and is going to assume the large portion of the grant duties. I have taken over as the insurance coordinator, and I've also taken on some of the HR duties from Wilma Muncie. For the most part, the grants department has spent a large portion of the quarter training and doing COVID response. But we have applied for a No Kid Hungry grant to allow us to provide for Cooking Matters classes for our WIC, HANDS, and Well Child participants. Unfortunately, we were not funded for that. And we did also hear back on Tracy Aaron's Sexual Risk Avoidance Grant, Making a Difference, and that was not funded either. Now for Jamie Lee's Heart for Change grant, pretty much we have not been able to do a lot of the functions of that grant because of COVID response. And so because of that, the grant has allowed us to file for a no-cost extension so that we can continue the activities of that grant through one more year, and that would make that grant end in May of 2022. And that's the end.
All right. Any questions then about our grants? All right, Melanie, thank you. Next then will be our RHOP update. We have Laura going to update us on that.
Our RHOP program, the federal grant ended in the end of September. So that was a 3-year grant. Our goal was to reach 500 participants, provide case management to 500 folks at risk for substance abuse disorder. And we worked with the jail systems and just self-referrals. We ended up having 417 participants. So granted that the last 6 or 7 months of the grant was affected with COVID, we were pleased with that number. We provided some sort of service to each of those individuals, whether it was social services, referrals to treatment, transportation, housing assistance, in any of those things, and many of those folks got several of those services. A fourth of them, 107, were referred to inpatient treatment. We received some state funding this fall to be able to continue those programs. So we are looking toward continuing the work that we were doing and have done for the past 3 years with those clients. So we're pleased about that. Thank you.
Judge, by the way, several board members joined after we did roll call. I might suggest that if you weren't part of the roll call, if you would type your name into the chat, Melanie can look at that and count you as present.
Okay. Okay, Laura, thank you for that update. As hopefully we'll see the late additions added into the chat there. We'll move on to our rounding environmental fees. And Stuart Spillman, would you care to take us there?
Okay. Hello, everyone. On rounding the environmental fees, every year as fees have that's the small increases, percentage increases, it ends up putting our fees with some change on the end. So, for example, one of our fees is an existing system fee, which is where when somebody is maybe setting a mobile home or building a home and there's already an existing system there, we're required to go out and do an inspection on that septic system for them to get their electric sticker. And that fee is $99.82. Well, that has caused us all kinds of problems for some reason with people. So we're not really supposed to take cash, and we don't usually have change on hand. So they'll come in with 100, and they'll want us to change it, and we can't. We either don't have the change, or we'll tell them we're really not supposed to take cash, or they'll tell us just to keep the change, which we can't do that. Or they'll get a money order, and they'll get it for the wrong amount. And then we have to go through that whole fiasco with trying to get it exactly right. So, and on top of that, it does make some of our things hard to add up when you have that weird amount of change on there. And people just aren't expecting that when they come to the health department. So what we're asking, we'd like to just round those fees to the next whole number. So whether it be, I mean, if it's below a 50 cents, we would round it down to the whole number, or if it's above 50 cents, we would round it up to the whole number. If we could do that, and that's what we're asking.
You would round it to the nearest dollar.
Yes, to the nearest whole dollar.
Okay, I've got I guess a stupid question. Why would a fee have odd cents in it, Stuart? Why wouldn't it be a round number to begin with?
Well, it always has been
type deal, or
no, it's always been a round number, but beforehand. But a couple of years ago, the board had decided to when we were so far behind on on-site fees, that program was so far in the red, the board decided to make just small increases every year, a percentage increase, a 10% increase every year, to be able to catch those fees up. Instead of doing it all at once, the board at that time decided not to do that. So they wanted to make this small increase
rather than a dollar figure increase.
Yeah. So whenever we done that, it ended up kicking that fee to having change on the end. So it's an odd number, like $99.82. So it's an odd number all the way around. So if a fee ends up being, whatever the number is, we just want to be able to round that to the whole dollar, whatever it is, not go up to a whole number, but even if it's an odd number, even if say it was $83, we want to round it up to, to just something without change on the end.
So if it was 82.75, you'd go to 83, and it was
exactly
45, you'd go to 82.
Yes. And we don't even care. We'll round. We would even round them all down, just as long as we could get to, just a dollar without change on it.
And have you talked to the auditors about that? Do they have a problem with that method of doing that?
Judge, it's up to the board to set its fees. So for this program, so whatever you all say will be all right. We just need it in the minutes that you approved it that way.
Okay, so you entertain a motion for that right now? Is that what you're saying?
Yes, sir.
John, what time of year have we been increasing those?
I guess we do it at the first of the year. Stuart, is the first of the fiscal or the first
of the calendar year?
Okay, so January.
Yeah. And I'm sorry, Judge Phelps, I'm not able to hear you.
I'll make a motion that we round them to the nearest dollar.
Oh, okay. Judge Phelps made a motion to round to the nearest dollar, in case you couldn't hear.
I'll second that.
Who was the second? Gail?
Yes.
Okay, so we have a motion and a second to round those fees to the nearest dollar. Any further discussion on that? All in favor, please signify by saying aye.
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 And by the way, we publish our fees on our website, and then we handle, we have our fees posted in our offices. So we'll make that adjustment so everyone can be notified.
And then, and likewise, any opposed, would you please signify by saying no? Okay, the ayes have it. Thank you. Is it all you have then, Stuart?
Yes. Thank you all.
Thank you. All right, moving on then. Sean would like to speak to us about a Christmas bonus.
Yeah, this year we asked you all, and you approved to give us a actual increment. And we hadn't done an increment for a few years. We had been doing we had done an actual raise, a percent raise this year. And you all approved that last year. And we're implementing that as the year goes on at folks' anniversary date. And I hadn't anticipated asking you guys for any kind of, a one-time increment this year because you did that for us. However, we've had so many of our employees now that are having to sacrifice so much, working 2 shifts and weekends and through the holidays. And there's really not much I can do to show my appreciation for the staff, being a government agency, other than just telling them I appreciate them. And I've been telling them I appreciate them now since March. And, every week I'm asking them again, give up your weekends, give up your nights and things, which, a lot of people in jobs have to do that. But that's not what the staff signed. Anyway, they've done a fantastic job. They've worked very hard, and I just think giving them some sort of a bonus, it would actually technically be a one-time lump sum increment is the proper name for it. And just in recognition of their contribution, just as a thank you, as a kind of, so, if you did you could do $1,000, it would be a $220,000 overall one-time impact to the agency. If you did 500, it would be half of that, 110,000 one-time impact to the agency. So I'll throw that out. That's not my decision. It's your all's decision, but I'm suggesting you do that.
Do we have any thoughts, any discussion on this matter that y'all want to bring up?
I'm trying to remember. We did talk, was it our last meeting? We talked about the like on-call pay. What did we do with that? I remember seeing that in the minutes.
Yeah, we adopted the rule that the state required us to adopt. We do the on-call pay, and it's aligned with the state rule, which is a little different than the private rule. I can't really remember it. Carol, you're online. You probably have a better recollection of how that works than I do. We got it approved and we did it, and I moved on to the next issue.
Yeah.
So how does that work?
So it only impacts a very small portion of our staff, I believe mostly nurses. If they are on call, they would get 2 hours of pay if we don't bring them in. But if they end up working, they would just get paid for what they worked. So I think we do mostly schedule our staff instead of having people on call. I think that Laura could speak to that, but again, it impacted a very small amount of our staff.
And the truth is, there's almost never an instance now with so much surge that if we've got you down that you don't end up working. So,
that's what I was thinking, Carol, what you cleared up right at the beginning there, that probably didn't impact a large percentage of the people that are putting in so much extra work, right?
That's correct.
Can you hear me? Because I think it would probably be a good idea to have a bonus, Christmas bonus.
Yeah, technically it's a one-time increment, but it comes at Christmas time, so it feels like a Christmas bonus. If you're making that a motion, are you motioning 1,000 or 500 or some different amount?
Oh, I don't know about that. The finances, what did we do last year or the year before? Was it like 500?
We've done 500 most of the years. I calculated it this year at the 1,000 is $220,000 impact. 500 is half of that, $110,000 impact. That's that estimate. It'll be a little more or a little less, but.
Well, we're finishing, from what I remember on his report, we're finishing with quite a large surplus, right? Would that help take care of some of that?
Well, the surplus would cover it. I mean, to be fair, we've got a large liability to the retirement system, but we're going to be paying on that for a long time, anyway. So it just depends on how you want to look at it.
I know we're only allowed to have so much surplus, right?
Yeah, and they've allowed us to go over our surplus because we've made a commitment to put, funds toward the retirement system. So they have let us go over our allowable surplus. So we have more than we're allowed to have right now, but we have intentions to make payments to the retirement system.
Sean, this is Dr. Miles.
Yes.
I know that we are working these people to death, and I know that dealing with some of the public, I've had a few discussions in the barbershop and that sort of thing. They're not always being treated the nicest. I don't know if $1,000 is going to help them all that much, but I would be for that at this point in time. Now, this is a one-time thing, correct? Or is this an addition to their salary? Make that clear.
This is a one-time increment. Yeah, so
Right.
they just get a lump sum payment, and then that would be the end of it.
At least let them know we care a little bit about them, because I know it's been a tough year for all of them.
I know
And
it's
so
been a
I
very
would
hard
recommend
year.
make the recommendation.
Yeah.
Yeah.
I think 1,000 would be
I would
good
recommend-
because they've really worked hard.
Exactly.
Dr.
So I'll make
Miles,
that
is
recommendation.
that a motion you're making?
That's
to-
a motion.
for one-time, $1,000.
$1,000. Yes, sir.
I'll second that.
We have a motion and a second. Any further discussion on this matter? All in favor, please indicate by saying aye.
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 Any opposed, also in like manner? Okay, motion carries. Congratulations to our employees. Thank you for all your hard work.
Now Carol's got more work to do than she expected.
That's the good work,
Move
though.
on. We'll move on then to our continuous improvement, our QI projects, etc. Sean, want to talk about making the suggestions on the back of the agenda?
Yeah, it's just, well, you can't hardly write them on the back of the agenda and turn them in today, but you can put it in the chat box, or you can always email me. We always want to hear back from the board. And, I have heard from several of you guys through this COVID response. Several people have made good suggestions, some things that we adopted, and I've always appreciated that. Some of you guys have thought we were doing too much, and some of you guys have thought we weren't doing enough, just like the general public. So I appreciate, though, for you guys that land on the one side of the issue, regardless of what side of the issue you land on, you all pretty much stayed out of our way and let us do what we need to do, and I appreciate that.
Thank you. And then next then, I guess, will be Stuart. Would like to talk about the online food handlers course.
So as far as the course goes, we still we have paid ourselves out of that course with all the development fees and all that ever since that happened about July this past year. So the course is in around A good probably 90% of the state of Kentucky is using that of the health departments. So we've been very fortunate, and I mean, we developed a good course, and I'm not trying to brag on myself, but or our guys, but it is a good course, and we have such a relationship with the rest of the health departments in the state that they they trust us, and they're willing to use our a product that we develop. So that's I think that speaks to Lake Cumberland District and our relationship and the way that we're looked at across the state with other health departments. So that has brought in, now of course this is not to Lake Cumberland, but I believe in total we're around the $400,000 mark since last August. So we have done incredibly well with this program, and the fees end up being split out between the other health departments that use the fee. They get a piece of that. Of course, the developer gets a piece of that for ongoing costs with server fees, maintenance. They do the support now, so that pays for all that. And then for all the other districts, is we do the administration, and they run through an account that we have totally separate, and pay out of that to the health departments. We actually get a small portion of that fee also, even for the other places around the state. So it's worked out really great. And again, like I say, we've paid out. So everything that we're getting now is just, it's just basically profit for us. Well, now let me say this, not necessarily profit, but we're able to use that money to go towards deficits where we don't make a profit. So deficits that we have in other programs. So that's what we do with it.
It was a good innovation on our part. And we, like Stuart said, we've paid out of our investment. We paid a lot of upfront money to cover the development of the computer program, and that's all been paid off. And one of the other things we get when we collect the fees from the when the food handlers or the food managers get certified in our district, we don't pay an administrative fee to the developer. We keep our entire fee. All the other health departments pay the administrative fee. Plus we get, like Stuart said, just a small percent for doing the accounting part for them. So it's worked out good for us.
All right. Any questions on that? All right. Thank you, Stuart. Next then will be our new employee orientation with Carol Huckabee. And I guess you also have the employee harassment training if you want to take care of both of those.
Carol, you're muted.
Okay. The employee employee harassment training we've kind of put on hold due to COVID and HR being so busy with bringing on and training the contact tracers. So that's been put on hold. We were working with other HR managers in the state, so everyone is busy, and so we decided to put that on the back burner for now. The employee orientation, we originally had planned to roll that out. We were going to do as we hire new people, we were going to bring them into their local health department instead of traveling them to Somerset for orientation. We would be doing that training via Zoom and email their forms and those types of things. with COVID and our local staff being so busy, we have continued to bring them into the district. However, we are, because of COVID, we are setting them up and doing the orientation via Zoom as if they were in their home location. So far, everything's working well. We've piloted it, and once things calm down and our local staff are able to help us by helping the employee log on to the computer for the first time and those kinds of things, we will go ahead and fully implement that.
Okay. I have any questions for Carol? All right, thank you very much then, Carol. Next then will be our employee satisfaction surveys. Janae, I have that, and also the director and agency board survey.
Mr. Crabtree emailed out the summary of the employee satisfaction surveys last month, and there's also a copy in your packet that he has put up there. So I won't read over those. You can look at them and see that the results were still good despite the long hours and extra duties and stuff that staff have had placed on them, the extra burden. And we still got good feedback. We have wonderful staff. The director agency board survey, the last couple of years, we had been doing that on paper and we seem to get better feedback. But I think this year we're going to have to go back to the Survey Monkey. So I'll ask Mr. Crabtree to forward that to you all in the next few days. And we'll do it that way this year. If you can't complete Survey Monkey, if you'll give me a call or something, I'll mail you a paper copy that you can send back in.
Yeah, as Janae said, I read through all of most of the comments on the employee satisfaction surveys, and there were very, very few suggestions. Most people, most of our employees are very happy. We had a good response rate this year, and I was pleased with the feedback, particularly at this difficult time. As far as the board survey, we do want your all's feedback too. If it's a survey about how you think I'm performing, and then how you think the agency's doing. So do fill that out and send that back in. The judge needs that kind of information when he does my performance evaluation too, to see how you all feel like I'm performing. So fill that out, please.
All right. Is that all you have, Janae?
That's it. Thank you.
All right, then we'll move on. Then it looks like we're going to bump the EPI report to March meeting. So we'll go ahead and get into the partner engagement and talk about our syringe exchange program, our progress with Tracy Aaron, please.
I apologize that my camera's not working tonight. As far as the update and community progress with syringe exchange program, the last presentation that was done by Dr. Miles to the Cumberland County Fiscal Court. And after that, we actually went into COVID mode. So at this point in time, we were going to talk about potentially doing a presentation to the City Council in Burkesville, Judge Phelps. And we have not done that yet. I know there was a lot of people talking with the ASAP board down there too, just to see and to fill out, I guess, what the community was expecting, or questions, comments. Maybe you want to share a little bit about that?
Said we were in the full COVID mode just right after you all presented here. I guess I shared Dr. Miles' presentation with Mayor Guffey. Did you all have any correspondence after that about trying to go to the city council, or was that all on me?
We have not, because COVID hit, to be honest, and I have not reached out since then.
Okay. Well, to further the problem, City Hall was destroyed by fire about 3-4 weeks ago, I guess. So they're trying to get their feet back on the ground. Fortunately, everything in the record side of City Hall we were able to move it across the street into the building that houses our senior center. So there's enough room for them to establish office space there. So things are even further up in the air. But I'm not even sure how they're handling their council meetings. I guess they're doing them all by Zoom, which that presentation was awesome. I think all my magistrates were very pleased with that. Let me reach out to Billy. I mean, do you all want to try to do that in the Zoom format if they're having their city council meetings by Zoom? Is that something you all want to attempt to do?
I think we could do that, Dr. Miles.
Yeah, Tracy, that'd be fine with me. I'll be happy to do that.
Okay, I'll reach out to Mayor Guffey tomorrow or Thursday. I got to be on the road to Frankfort tomorrow, but I'll get with him this week. And they meet the third Thursday of each month. So, and like I said, I know this is a crazy, crazy time. That's their normal meeting time. Is that so? They would normally meet December the 17th. Is that something that you all would want to attempt to do it that quick? I mean, with all this COVID stuff still going on, or January? What are y'all thinking?
Well, we could probably do the same presentation we did for you, correct?
Yeah, I think that's exactly what you all need to do. I think my magistrates were fairly impressed. But it's one of those things. I think everybody needs to feel like everybody's on board all at the same time to make it go with it.
If Tracy can do it, I can do it, Tracy.
Yes, I think I can.
Okay, I'll see if they can get you all on the agenda then.
Thank you, Judge, for doing that.
Yes, ma'am.
All right. Is that all you have then, Tracy?
Yes, sir. Thank you.
Thank you. Next then we'll go to our oversight. We want to give a COVID-19 update. We all know what a difficult year this has been, but our staff here has worked very diligently, and I don't know how they've done it. I don't know how they haven't just thrown their hands up in the air and said, I quit, but they're still doing well. And we're very informed, and I think they've doing their best to educate our public and to keep us safe. But we'll go ahead and hear an update from the team here.
Okay, good evening, everyone. This is Amy Tomlinson, Preparedness Manager for Lake Cumberland District Health Department. And I'm going to actually start with Amanda, who is our Senior Epidemiologist for the region. And she's going to do the first part of this presentation, and then I'll take over about midway through.
Okay, thank you, Amy. As Amy said, my name is Amanda England, and I'm the Regional Epidemiologist. So beginning, I'm just going to remind you all of the common signs and symptoms of COVID-19 cases. And I will say that some cases are asymptomatic or they do not have any signs or symptoms. So that is a possibility. And then this list is a list of the most common signs and symptoms of COVID-19. These have not changed since the last meeting, so these are the same as the last meeting. Next slide. Okay, this is a map of the case rate in the US, and this was as of this morning. And as you can tell, the lighter color of blue have the lower case rate, and the darker blue is a higher case rate. As you can see, Kentucky is kind of in the middle. So compared to some of the other areas of the US, we are about in the middle as far as case rate, and that is cases per 100,000. Next. Looking at Kentucky, since March 6, 2020, there have been 1,079,041 cases, and that is comprehensive as of last night. And then you'll also see how many have been tested roughly, and deaths we have had in the state of Kentucky, 1,908. This is a current incidence rate map in Kentucky. This is a little different than the map we showed you all at the last Board of Health meeting. Kentucky has now went to an incident rate, And they're also color coding the counties as green on track, yellow is community spread, orange is accelerated, and red is critical. As you can see, all of the counties in our district are red, as well as the majority of the state. Only 3 counties are in the orange. So this is, again, the current incident rate. So this takes into account more of the current cases. The old map showed us cumulative cases.
I'm trying, Amanda.
Okay.
For some reason it freezes. There, okay.
Okay, thank you. So looking
Sorry.
at statistics, in Lake Cumberland, our hospitalization rate is 6.41 compared to 5.62 for the state. So our hospitalization rate is higher than the state, as well as our mortality rate. Our mortality rate is 1.54 and the state's is 1.07. So both in hospitalizations and mortality, our rate is higher, as it has been in the past as well. And as far as our district, we've had 129 deaths, which I'll go more into that in the next slide. But as you also saw on the state map, every county in Kentucky has now had at least one case, if not many more, of COVID-19.
Yeah, and by the way, our hospitalization and our mortality rate's much closer to the state average now than it was even at the last meeting. COVID hit us really, really hard early. And over time, you know, we're sort of drifting toward this state average.
Yes, that is correct. And as I was making these changes today, that I noticed that we are closer now to the state as far as hospitalization and mortality than we have ever been. So that is hopefully a good thing. So looking at our district case counts, these are as of last night, and I'm not going to go through these individually. I just want to draw attention to a few categories. Since our last Board of Health meeting, which was September 1st, we have had an additional 6,404 cases in our district, which is, it's just unreal to think. So a total, we have had 8,397. Looking at deaths, we have had 129. That is 67 additional deaths. And again, you can, all this information, you can look at on your own. I'm not going to go over that, but you can see all of the counties have had a significant increase in cases as well as deaths, unfortunately.
Okay, and so this is the map that we send out every evening with our public information brief that just shows our specific counties. And you can see, as Amanda pointed out, that they are all in the red or critical spread area. One thing about the increase in cases that she reported on in the last slide, as I was doing the evening numbers last night, I started looking at just for the numbers for November, since that ended yesterday. And we reported almost 4,000 cases, I think, through the course of November across our 10 counties. And we have just a little over 8,000 cases for the district as a total since March. So when I calculated that up, it ended up being about 47% of the cases for our total 10 counties since March occurred during the month of November. So that's an illustration of the surge that Mr. Crabtree has alluded to earlier and that Amanda has referenced, and just exactly how that's happened, and especially over the last 4 weeks or so. And this is another illustration of that. This is something that we track in our Department Operations Center. We look at how long it took us to get to the first 1,000 cases in our district. It took 133 days. For the next 1,000, it was 35 days. It stayed in that range for a couple of times. And you can see that now this last 1,000 cases, from 7,000 to 8,000 cases, ended up being about 8 days. So the spread is accelerating, it's increasing, and the workload is ever increasing along with it. Okay, so it's kind of hard to imagine, but this all actually started the 1st of March. March the 3rd was when our Department Operations Center was activated. So we are now currently in week 39 of our activation. It's been 258 days since our first case has been reported in Lake Cumberland. And you know, back in March when this started, I don't think any of us really anticipated that this would have been going on at this level this long. Our response has been wide and varied and comprehensive. We have reassigned staff across the agency into new roles and new duties. They have stepped up and performed admirably and just without flaw. I mean, it's just amazing to me to see the resiliency of our staff to keep going and to take on new roles and new duties and to just keep going. The dissemination of information and the guidance that's ever changing from the state and the federal levels has always been one of our top priorities. And as such, we've done the daily public information briefs since the beginning to share information on case counts and numbers and new guidance related issues and topics. We also established an internal call center to help field calls and questions and to route questions and concerns appropriately to the correct person. We do a bi-weekly now media brief with reporters across our 10 counties that they're able to submit questions to us, and anything that they want to ask or talk about, we're willing to talk to them. Used to be every week, and we've kind of gone now to every 2 weeks since that there hasn't been that much changing other than just the numbers of the cases. The guidance really had not changed a whole lot for the past couple of months until recently with the new executive order. And then the other part of our response that has been one of the most challenging parts of all has been the compliance or the enforcement issue of the mandates and the executive orders. That has been something that, has turned political, and it's just very taxing and weighing on a lot of our staff, to have to go in and enforce some of this stuff. What we want as public health is for people to do the right thing because it's the right thing, not because they're being told they have to do it. And we just can't seem to get there. So we are eternally looking for partners and public messaging and things that will assist us in getting that word out and getting our compliance and everything up to where it needs to be. So to date, as of tonight, or as of last night, I guess, we had investigated and reported just a little over 8,400 cases in our district. And of those, each one of those cases averages about 6 contacts per case. Some have a lot of contacts, some have very few contacts. So on average, it's about 6. That comes up to over 50,000 contacts that have been investigated in relation to those 8,400 cases. So you can see that the workload, that we've referred to all along, that's something that's just a huge amount of responsibility and work on our staff. We've had cases and outbreaks tied to long-term cares, churches, businesses, industry, travel, schools, jails, family gatherings, events. At this point of our response, it's pretty much you name it, and we've had cases there. This last couple of months or so, we've seen more. The new areas, I guess, have been our jails. We hadn't had a lot of cases in incarcerated individuals until the last little bit, and we're starting to see that more and more. Family gatherings are a big event. I think it was Kristen that asked earlier about contact tracing, and that's something that at the Department Operations Center, when we have these discussions, that's one of the very last things we want to ever give up, because as Mr. Crabtree mentioned, we feel like that's going to create more work in other areas when we're no longer able to do that. So that'll be one of the very last things. We're going to hold on to that, I think, until the last breath leaves our body nearly. I mean, we are very adamant about the case and contact investigation. During the course of this response, we have applied for and been awarded an expanded lab capacity grant. And as such, we have purchased a mobile unit, which is a van that is going to help us go offsite and do some mobile testing and some maybe vaccinations. It'll just be like a mobile clinic that we're able to take around to the 10 counties. We will have rapid testing equipment in there, and we're going to be hiring additional staff for that. The mobile unit, the van itself has been purchased and is actually been delivered offsite down for the build out for the customization and everything that has to be done for that. And we anticipate getting that back sometime after the first of the year. So we will be looking at targeting high risk congregate populations, homeless shelters, maybe the jails, just anywhere where there's a large group of at-risk individuals. Okay, so vaccination planning is underway. It is on my brain and in my head 24 hours a day, 7 days a week for the last little bit. I can't get away from it. So the vaccination, we are expecting vaccine to be approved at the federal level, possibly as soon as next week. There's hearings that we're expecting that will be approved next week. After that's approved, then there will be the priority groups will be identified, which we already have an idea of who those are going to be, but the priority groups will be identified after that hearing next week as a final round of planning. The tiered approach is going to be healthcare workers and long-term care residents first. And that'll be the ones that when we get the very first rounds of doses of vaccine, it'll be for first responders, healthcare workers, and long-term care residents. We are working hard all the time to establish agreements and get these plans in place with all of these providers to vaccinate everyone as soon as this vaccine is available. That's really the only thing that we have left in our arsenal, to get this under control and to move on past the COVID response is the vaccination. We're looking at points of dispensing locations. We call those pods, and we're looking at open pods and closed pods. Closed pods would be where partner organizations agree to vaccinate their own populations, whether it's their workforce or their residents, their clients, their patients, whatever, just a certain designated population that they're willing to vaccinate. An open pod would be something that a community partner or the health department would have to staff where anyone in the community could come and get their vaccine. So the more closed pods we have identified ahead of time will reduce the number of open pods that we have to have, because it'll pull those people out of that general population that will need to be vaccinated. Let's see, I want to talk about Mr. Crabtree actually rolled around some thoughts in all of our heads the first part of this week about remote operations planning. So we are in high gear with that right now. The thought came to him because we are starting to we have had over the past few months, a couple of clusters or outbreaks within our own staff at some of our own clinics. And so if that should happen, we will need to close the clinic for a day or maybe a week or whatever and disinfect the building, allow staff time to recover or to have the cases investigated and that kind of thing. So if the need should arise that we would need to operate remotely, how would we go about doing that? And is our staff ready to do that? Do we have the equipment in place? Do we have the technology that would allow that to happen? So we're in high gear planning for all of that. And of course, that also occurred to us this week because of the snow that we had, because we thought, this was the first snow of the season, but many more are coming in the few months ahead. So if a snow happened and staff couldn't report into the building, can we continue operating from our homes or from remote sites? So we're looking at that. We continue to consult almost daily with long-term care facilities about outbreaks and cases that they're seeing. Our jails, like I mentioned, are starting to see cases, and we're working with them to create their isolation plans and testing plans. And then our EMS and healthcare workers are being affected by this virus at an alarming rate right now. We have several agencies and organizations that have providers out, that have responders out, that are either quarantined or cases. And so they're having some staffing issues related to all of this. So we're looking at things like patient transport, how that will work. If a bunch of our EMS guys go out and are not available to work, how do we cover for each other? So those types of things are very serious. And anecdotally, we're starting to hear that maybe testing is becoming a little bit more not as readily available, that there's possibility of testing, the labs that supply the testing not being able to supply as much as it once had. So that's a concern to us. We're also starting to hear shortages again of PPE in some of our facilities, or that the vendors that supply the PPE to some places are not able to get it. And of course, staffing in our hospitals and the long-term cares are always a concern. When we start seeing cases in those types of facilities and people start getting quarantined and isolated, the care for the residents and the patients is a concern.
Yeah.
So I don't want to sound like doom and gloom. The vaccine is our biggest hope, and I'm certainly anxious for that arrival of that. Mr. Crabtree, did you have something else? I'm sorry.
But, it is, you don't want to be doom and gloom, and there is hope in the vaccine. But the truth is we're very close to a breaking point with our medical community. You know, we have spoken to several of our hospitals, and you know, we know that they're starting to have shortages of key equipment and supplies and space, and not able to get the staffing that they need. Now, they're not breaking yet, but they're a whole lot closer to breaking than they were, and they're a whole lot closer to breaking than they want to be. A couple of things I want to just reiterate. One thing Amy said, we've been doing this since March, and all the work we did as far as casework for 8 months, we repeated that in 1 month. We did 8 months worth of work, and then we doubled those number of cases in 1 month. So it was really increasing. The second thing, Stuart brought this up today. He heard it on another meeting, and I independently verified this just to see if it was true. You know, people will say that this is nothing more than the flu. If you take just the United States deaths for COVID-19, it would take 7 years worth of flu deaths to add up to what we've had so far for COVID-19 in less than 1 year. So it's already that much worse than flu, the outcome. So, you know, whatever it is that we were doing as a community before this last governor restrictions, it wasn't working. Cases were spiking. Hospitals were getting to the breaking point. We were getting to the breaking point. You know, something needed to change. And, you know, one thing, you know, that we do is we talk with different community leaders like school superintendents and event planners and business owners, and we give them all the information. And, you know, it seems like everyone wants to carve themselves out of the responsibility. You know, I spoke with several school superintendents who were still having in-person instructions who just said, thanks for the information. Very politely, we're going to keep doing what we're doing. I spoke to several event planners who said very politely, thank you, we're going to keep doing what we want to do. I've spoken to members of the public that refuse to mask and social distance that just says, thank you, we're going to keep doing what we want to do. You start carving out so many different things, and before long you don't have enough of a community commitment to spacing and distancing and stuff that you have any kind of real effective approach to holding this thing back. So you know, there's no good answer. Mother Nature is tough, and this is hard, and somebody's going to end up hurting no matter what we do. And, you know, I'm looking forward to the vaccine.
All right. Well, definitely a long, hard battle we're facing. I mean, y'all have done as well as could be expected. We knew from the very beginning when we first started talking about this that this was going to spread, and our goal was to try to flatten the curve and try not to overwhelm our hospitals. And I hope that we can get this vaccine out and not get to the point where we're like the mayor of New York, or the governor, I guess, of New York, who's begging for more ventilators to save lives. I hope we don't get to that point. Let's just keep holding out hope. I think there is hope, you know, and I'll just briefly, if you allow me as chairman here, is to share a little bit of my faith. I know this is not how the world ends. According to the book I believe in, this is not how the world ends. So folks, let's just hold on to hope. We'll get through this. Let's just keep working hard and be diligent and try to do our part to prevent this spread. So thank you all for that update. We'll move on, if there's no other questions or remarks there, to our human resources report with Carol.
I'll make this really short. Since our last meeting, we have brought on 28 contact tracer staff. Those staff are provided to us through Crown Services. Crown Services has a contract with the state to provide us with these people. So we've brought 28 of them on since the last time we met. In total, we have 48 contact tracers. And then we have had 2 merit staff go off duty since we last met. Sonia Whitus retired out of Russell County, and Jacqueline Hodges resigned out of Greene County.
Okay. Anything else? All right, we'll move on then to our policy development with Janae. Talk about new policies.
Well, we don't have any new policies or policy revisions this time, but we're getting ready to do our annual review, so we'll probably make up for it next time.
All right. Well, it's brought us to the end. Then we have to set our next meeting. I believe
We traditionally do it on the first Tuesday, and the next quarter would be March. So March 2nd is the first Tuesday, Judge. If that's what you want to do.
we'll go ahead then and set that for March the 2nd at 7 o'clock Eastern, 6 o'clock Central. And I'm sure you'll send out reminders to the group here.
Yeah, and I assume we'll continue to do this with Zoom until this thing gets under control.
Okay, well, I would take this time to wish everybody a very Merry Christmas and safe and happy holiday season. Take time and do something kind for somebody this season, because a lot of people are really depressed and anxious, and a moment out of your day to do something kind for somebody could make a difference in someone's life this holiday season. So take time to do that, and I promise you'll be blessed tenfold for what you do. But we'll go ahead and entertain a motion with no other business to
Don't move, Judge.
Motion
Don't
from
move.
Judge Phelps. We have a
Yes.
second.
I'll
This is
second
yeah.
Judge Craig.
All right. We have a motion and a second. Any further discussion? All in favor?
Aye.
Aye.
Any opposed? All right. Thank you all, and you have a Merry Christmas.
Good meeting y'all. Thank you all.
Bye-bye.
Merry Christmas.